day. My name is Zosha Desaskobovnetsky-Gruber, and I'm the Policy Director and Gender Specialist at the British Columbia Council for International Cooperation. Today, I will be focusing on how BCCIC developed a PSEA policy, with emphasis placed on lessons learned and recommendations for other organizations going through this journey. As settlers, we can and should do better. And this starts with humility, reflexivity, and self-location. So to this end, we would like to acknowledge that BCCIC's work takes place in the traditional, ancestral and unceded territories of the Musqueam, Squamish, Tsleil-Waututh, and Tsawwassen nations. And we make this acknowledgement to pay our profound respect to the hosts of this land for their stewardship for time immemorial, and to remind ourselves of both their history and their present-day contributions to our society as a whole. The structure of this presentation is as follows. I will first describe the process by which a PSEA policy was developed. I will then hone in on some of the key concepts that I will contextualize within a legal policy context. I will then move on to prevention, response, and review, and end off with a discussion on member engagement and working with partners and communities. When developing our PSEA policy, we consulted with diverse stakeholders. This included women's organizations, experts in the field of gender-based violence and child protection, our members, as well as our chapters who work in northern and outlying communities. In addition, we embarked on a policy analysis in which we considered international, federal, and provincial policies in order to ensure policy coherence and alignment with our human resources policy, our ethics guidelines, as well as our code of conduct. Furthermore, we undertook a desk review in which we carefully reviewed best practices, promising practices, and toolkits that have been developed by other organizations so that we didn't reinvent the wheel. Internally, we undertook an informal risk assessment of our organizational capacity. On the one hand, this involved consideration of our financial and human resources, carefully considering whether we would be in a position to respond to a report related to PSEA. It also involved consideration of existing whistleblowing or grievance mechanisms within the organization. But we decided to take this one step further and consult with individuals. We consulted with small groups, as well as shared a very short survey with staff and volunteers, reflecting on notions around gender equality, power, intersectionality, and we really tried to pay careful attention to some of the barriers that staff and volunteers perceive would prevent them from coming forward and reporting such a case. But we also looked at some of the power imbalances that create a poisoned work environment that can enhance the risks faced by certain individuals and groups within the workplace, but also in the broader communities. Furthermore, we engaged with youth in the development of an abbreviated PSEA document, as well as posters on prevention and response. Youth are not only targets for BCCIC, targets for awareness raising, as well as capacity development, but we also see youth as important partners who bring considerable insight into what we do. And in this case, it was really, really important that the youth were involved in developing this abbreviated version because they enhanced the accessibility of the documents. Furthermore, we shared the draft versions of the PSEA policy with the board for approval. Within the board, a specific subcommittee was created that looked at the PSEA policy from the lens of leave no one behind. In other words, carefully considered whether it would be accessible for those living with disabilities, those in marginalized communities, whether we address some of the power issues that would enhance risks for certain marginalized and socially excluded groups. Furthermore, engaging with the board was very important in order to ensure executive buy-in, as well as resource allocation to PSEA. In addition, it was very important from the perspective of thinking about how we engage with our members and the extent to which PSEA would be included in partnership agreements, for instance. I'll be talking through some of the lessons learned at each of these stages throughout the presentation. There were three outputs, namely a comprehensive policy, an abbreviated policy, as well as then posters and guidelines that focused on prevention and response. All of these policies are available on our website and have been shared with Digna. There were several lessons learned. First, it is important to have a clear but realistic vision for the document. For BCCIC, it was very important that the document be a policy to which the organization and its members would be bound. It's also important to be realistic. In other words, consider your resources internally, both in relation to time, staffing required, for instance, for the role of a PSEA focal point, but also then to roll it out and implement it across all the organization's programs. And then obviously the financial resources in the sense of creating certain databases or creating awareness raising materials and training materials. It is also important to reach consensus on the process and inputs beforehand and ensure that outputs are accessible for the intended audience and purpose. And this is one of the reasons why we engaged youth to develop an accessible version, since we work extensively with youth in different settings. It's also necessary to engage in multi-stakeholder consultation, as I have mentioned. And this needs to take place in a setting that is safe, that is considerate of some of the barriers that might prevent individuals as a result of intersecting identities and positionalities from speaking out about their concerns around power, around discrimination, and around some of the challenges that they face that might actually put them at risk in the context of sexual abuse and other forms of violence. So it is important to plan for sensitivities and triggers as you embark on this journey. Furthermore, in terms of lessons learned, it is important to identify a focal point who is mandated and resourced, but also who is a champion for PSEA within the organization. However, it is important also to note that PSEA and the policy should not just rest in the hands of one person, but that all staff members have a responsibility to live, follow, and implement the directives of PSEA policies. And in addition to individuals, the culture of the organization should also be taken into account. So move beyond an individual to consider interpersonal context, but then also the norms, values, and practices within your organization and within the communities and partners that you work with. It is also essential that you obtain management buy-in, and we are grateful for CCIC for developing the leadership pledge to which our executive director has signed. And this will ensure organizational ownership, but it will also provide an impetus for resource allocation when it comes to actually developing and implementing the PSEA policy. Generally, it is very important that the PSEA policy is in alignment with the organizational values, principles, and mission, and reflects the culture of the organization. So for instance, at BCCIC, we consistently emphasize anti-racism, non-discrimination, respect for human rights, gender equality, and women's empowerment. And the PSEA policy was developed in alignment with these values. Similarly, BCCIC emphasizes intergenerational concepts when it comes to the development and implementation of programs and projects, and we highlight the importance of youth engagement, and that is why youth were brought on when developing our PSEA documents. It is also important, as part of our lessons learned, to engage in very informal as well as formal discussions around gender, power, and identity, because this forms the basis of the power dynamics and the root causes that lead to a power imbalance that might then create fertile ground for sexual abuse and other forms of violence to occur. It is also important to identify allies beyond your organization working on similar issues. And we are grateful for the support of Cooperation Canada and Digna in the early stages of drafting our policy, but we have also been working with some of our members on how to strengthen PSEA policies in the sector. Generally, we try to encourage learning and sharing, and BCCIC has, we've run multi-stakeholder collaboration sessions around PSEA policies. We've also hosted a webinar on PSEA sensitization and had a session on how to develop a PSEA policy that was directed at our members. Generally, regardless of what you are learning and hearing from other organizations, it is very important to tailor the concepts and to tailor the policies themselves to the organizational context in order to ensure relevance. And this comes up very strongly when we refer to some of the feedback we have received from members who are small and medium-sized organizations working in very different geographical and socio-cultural contexts. So in terms of terminology and concepts, there is a distinction to be made between PSEA and PSEA. Given the context in which BCCIC works in British Columbia, we found it very important to include harassment within our policy, but this is not necessarily the case for all the organizations or the members that we work with. There are a series of different definitions that can be found in laws and policies pertaining to sexual exploitation, harassment, and abuse. But there are several fundamental and underlying concepts that it's important to emphasize. The first one being intersectionality. We encourage our members, as well as our staff and volunteers, to complete the GBA Plus course provided by the Government of Canada, because it provides some practical insight on how to apply this concept of intersectionality. In the relation to this specific policy, we would like to emphasize that gender identification, sexual orientation, in intersection with other positionalities and identifications such as socioeconomic status, race, nationality, indigeneity, diverse abilities, and so forth, may actually lead to a series of power imbalances that create the grounds for coercive conditions or create the grounds in which abuse, exploitation, or harassment can foster. So on the one hand, it is important to understand what are the root causes of these unequal power balances. Is it related to having a poisoned work environment? In other words, a workplace that feels unsafe or unwelcoming? Is it related to deeper roots, such as colonial structures or colonial discourses? Is it related to patriarchal norms and values that support discrimination against women? Is it just related to racist beliefs that have perpetuated a series of stereotypes that have then created an unsafe or unwelcoming place for certain individuals? So when you start thinking about your policies and what needs to be put in place for prevention or response, it is important to think about the root causes of these unequal power imbalances and how they relate to intersectionality. Well, some of the lessons learned here, though, when you have these conversations among your members or with your partners and your staff, it's important to consider different understandings and interpretations of certain key concepts based on individual and socio-cultural differences. However, this is not to say that you should encourage cultural relativism, okay? What is key is that you understand the law and your responsibilities as individuals and organizations. However, creating safe spaces, using practical case studies and vignettes to have these discussions around socio-cultural differences is very, very important in order to achieve consensus around key definitions and concepts. It's also important as part of the process of sensitization around PSEA and awareness raising around PSEA, but it's also within the spirit of partnerships. In other words, if you engage in conversations with a very appreciative lens, recognizing that there are certain differences in terms of understandings, you're more likely to foster partnerships based on respect and mutual trust that will increase the uptake and the buy-in given to policies like this that are not seen as imposed or created in a top-down manner, but are actually embraced in a far more bottom-up, organic manner that is more likely to lead to compliance. Conducting a legal policy analysis was a very important first step in what we did when developing this PSEA policy. So we looked at a series of laws at international and federal levels. At a federal level, we considered the Feminist International Assistance Policy, but also very importantly, we looked at some of the recommendations of the Truth and Reconciliation Commission in relation to murdered and missing Indigenous women. We considered what this meant for some of the power imbalances that might create environments in which abuse or exploitation is fostered. We also looked at the Criminal Code of Canada and Canada's Labour Code in relation to some of the provincial laws and policies in order to ensure that there was policy coherence in what we included in our policy. So at a provincial level, we considered the Human Rights Code, BC Workers' Compensation Act, Occupational Health and Safety Regulation, and WorkSafe BC Handbook. And as an organization based in British Columbia, all of these policies emphasize the importance of including harassment. And for this reason, our policy does include harassment, includes certain principles, definitions, as well as response mechanisms for situations pertaining to harassment. For organizations like BCCIC, it is also important to understand your donors' requirements. So, for instance, we looked carefully at the expectations that were outlined by Global Affairs Canada in a letter to partners in 2018, in which it was stated, Canada strongly condemns all forms of sexual exploitation and abuse in international assistance. We all have a responsibility to step up to address these issues and produce a real shift in how we work. Appropriate steps must be taken to prevent, respond to, and protect beneficiaries of Canadian international assistance funding from sexual exploitation and abuse. And this was accompanied by a list of expectations, such as a culture of zero tolerance for sexual exploitation and abuse, high standards for vetting and referencing staff within the organization, clear publicly available policies and procedures, including codes of conduct, accountability mechanisms, clear roles and responsibilities, training, reporting mechanisms, monitoring and evaluation procedures for cases, referrals to relevant authorities in the cases of criminal conduct, annual reporting, as well as informing Global Affairs Canada immediately of alleged cases. Now, this does not necessarily mean you need to reinvent the wheel. I think one of the first important steps you need to do is have a look at your existing policies in place to understand where the gaps are in relation to this list of expectations, how you can strengthen existing policies to ensure that they encompass the values and the mechanisms outlined here. Or alternatively, if there is a need to create new policies, it is important not to reinvent multi-stakeholder partnerships and consultation mechanisms, but really work with your partners and existing consultation mechanisms in place to develop these policies. As I said earlier, we had to look carefully at some of the provincial and federal policies. And while they focused on different aspects of abuse, exploitation, and harassment, what is fundamental to all of them is that they emphasize that the employer, in our case, PSEA, is required to make reasonable efforts to ensure that sexual assault and other forms of violence do not occur. And these reasonable efforts include prevention measures, as well as response, investigation, and reporting measures. And important once again to emphasize that employers can be held liable for failing to protect their employees from violence in the workplace and can be held criminally responsible. So it is important to have this conversation with the board and your board members to show that not only is this important from the perspective of promoting human rights, ensuring women's empowerment and gender equality, but that there is a real liability here, and that there are real risks for organizations who fail to fulfill their legal obligations in the context of abuse and exploitation and harassment. So some of the lessons here that need to be emphasized is that mapping the relevant laws and policies at different levels can be very time consuming, and they can be resource intensive. So when planning to develop a new policy, you need to set aside the resources for this endeavor, or alternatively, partner with other organizations who are going through the similar journey so that you can collectively share resources. It's also important to emphasize that as an international non-governmental organization, whether you're small or large, you need to understand your obligations in Canada and in the countries that you're working. And you also need to emphasize that in the countries in which you're working, forming partnerships with local actors is key when understanding your obligations. Regardless of where you work, whether it's in British Columbia, whether it's in another province or more at a federal level and international level, you have an obligation to do no harm, protect and promote human rights, regardless of the context. Now, in terms of prevention, these are the following steps we took to create the policy. First, see what other organizations and countries are doing. And as I said here, sharing lessons is very important. Secondly, identifying your legal responsibilities and what help is already out there. Thirdly, consulting with experts and women's organizations. And I want to add here, consulting with local communities is very important. And creating spaces in which marginalized women or persons who are at risk of being left behind can be consulted is very important. All of these will then inform a vision statement, which shares your principles and values. In an organization such as PSEA, it is important that a vision statement is collectively developed in consultation with members and other partners. When developing the policy, it's important to make your documents and resources easy to understand and accessible. And it is fundamental that you obtain a firm commitment from the organization's leadership and support from all levels of your organization. This is not simply a policy where one can get by ticking the box. This is a policy that speaks to the culture of the organization that you're running. It speaks to your fundamental values, and it speaks to your broader mission. It's also important to create a conduct that is relevant for your work. So for many organizations working in humanitarian settings, looking at one Oxfam's policy on protection from sexual exploitation and abuse would be valuable. For organizations such as BCCIC, which does not work in a humanitarian setting, it is important to consider codes of conduct that are in alignment with HR codes of conduct that are in alignment, for instance, with the codes of conduct that have been developed by Cooperation Canada, as well as in alignment with the leadership pledge that I've already mentioned. So understanding what your organization needs in line with the local context in which you're working is really important to ensure that the policy you developed and the codes of conduct you developed are relevant. It's also fundamental that you assess and mitigate the risks. And in BCCIC's case, it is about looking inwardly at the work culture. But in many of the organizations, it involves looking beyond your specific workplace, but also in the communities in which you work. So in order to assess and mitigate the risks, there are various different risk assessment tools out there that have been developed by large organizations. But fundamentally, it involves asking uncomfortable questions, such as who makes decisions in your organization? Who is at risk of being left out of decision-making? Who exercises power in different relationships and situations? Are certain practices, behaviors, and norms creating power imbalances? Are staff feeling intimidated, unsafe, or uncomfortable? Is this being perpetrated by individuals, or is this systematic, or both? Is gender equality and a culture of non-tolerance promoted in your organization? Is positive dialogue encouraged around social cultural constructions of appropriate and inappropriate behavior? Is the workplace inclusive, equitable, and respectful? And what prevents staff from speaking out about their concerns, and what barriers do they face when seeking help and support? As an organization, you need to think carefully about how you would undertake this risk assessment. In some situations, it might be appropriate to have focus group discussions in which you ask these questions. However, if you go this route, you need to think about whether the spaces are safe and whether they're inclusive for employees, staff, and volunteers of different genders and sexual orientations. Are they safe and inclusive for those who represent marginalized voices, or who out of lived experience have faced various different barriers and different forms of exploitation and discrimination in their communities? Are one-on-one conversations more appropriate? Or alternatively, are anonymous surveys more appropriate and effective when asking these type of uncomfortable questions? So I would really encourage you to think about what constitutes a safe space and safe for whom in these particular contexts, and what conversations would be uncomfortable and why would they be uncomfortable for different individuals in your organization. I would also encourage you to think about how you would ask these uncomfortable questions in different communities in order to understand risks faced by certain individuals and groups. There might be ways in which you conduct these conversations that are actually excluding marginalized voices, such as people living with diverse abilities. But this is an important aspect of understanding and understanding what are the potential risks and how to develop a policy that can then mitigate some of the risks to prevent sexual exploitation and abuse from occurring. The next aspect to consider when developing a policy is recruitment and training. So there are certain steps that seem relatively easy on the outset. So conducting background checks on new employees, asking employees to sign PSEA policy declarations and displaying posters, developing and implementing a training plan, which then includes an aspect of refresher training and is documented on a spreadsheet, creating or providing additional training around anti-discrimination, cultural sensitivity, and intercultural communication, so as to address some of the root causes and power imbalances in your organization that might lead to sexual exploitation and abuse. Reviewing compliance and performance reviews, and then reminding employees about the policy on an ongoing basis through awareness raising, posters, ongoing or refresher checks. On paper, this sounds easy, but you do need to think carefully as an organization, what is the most effective way of offering this training and who it is being offered to? Okay. So in some contexts, Offering the training through online methods might be a quick and easy way to ensure that new volunteers and staff have got basic sensitization around the key concepts. But in other organizations where there is a need to engage more meaningfully with, it is important to think about how you would conduct face-to-face training. And if you're conducting face-to-face training, what type of social support, psychosocial support should be on hand to provide support to individuals or groups who might be triggered by the training. Okay. And lastly, it's also to think about what training should be provided to address some of the root causes of abuse and exploitation. And as I said earlier, this could be anti-discrimination or anti-racism training, cultural sensitivity training, intercultural communication training that goes beyond the specific topic of sexual exploitation and abuse. We have already found in our organization, training around decolonization and training on anti-racism is really, really fundamental towards creating trust, an environment of respect, and promoting inclusivity, diversity, and just a feeling of safety and workplace well-being. Another aspect of prevention that needs to be emphasized is collaboration and coordination. Okay. PSEA focal points should be identified and trained. We are very grateful for the opportunities provided by Cooperation Canada to train and work with our PSEA focal points and provide opportunities for peer-to-peer sharing and learning. But it's also important to collaborate with gender specialist partners and members and partnering with local communities. And I'll provide some insights on that later on. Internally, raising awareness is one thing. In other words, displaying posters and other resources, offering training and capacity development is another. So for instance, at BCCIC, we've provided sensitization training on PSEA to our members and staff, but also we have offered training on how to develop your own PSEA policy for our members. And this has been complemented by training on intersectionality, training on decolonization and anti-racism, because they all feed into each other when we're thinking about power imbalances and the work we're doing in promoting equity and social justice. Part of coordination and collaboration is also constantly monitoring and reviewing the policy. Is it current and is it working for everyone? And keep checking in with your organization's staff to see if they are feeling included, respected, and safe. It's also important to think beyond the policy. The policy shouldn't just be about responding to incidences, but it's also about helping others in the broader community to understand how they can contribute to a safer, more inclusive and equitable society. And then lastly, as we know in terms of gender equality work, it is only effective and it only has an impact when it's mainstreamed across all programs and projects. And the same is for PSEA. PSEA considerations need to be considered when designing any policies or any projects within your organization. It needs to be mainstreamed and foregrounded in terms of implementation as well as monitoring and evaluation. So some of the lessons we've learned in terms of prevention is that prevention is more than just raising awareness through posters or building capacity through training and mentoring, but it is fundamentally about understanding and reflecting upon and transforming power dynamics rooted in social hierarchies, discriminatory and colonial, patriarchal and racist social norms, exclusionary and harmful social practices. So transformation truly is it's more than just a policy, but there is a process of self-reflection, organizational reflexivity that is an important step in this process. At BCCIC, we're starting it through our Gender and Jedi audit, our anti-racism training series, our seminar series on decolonization, as well as ongoing and dialogue and internal reflection around concepts such as anti-racism, decolonialization, abuse, exploitation, and power imbalances. And then there are questions that we need to think about, like how far can and should small and medium-sized organizations go in addressing deep-seated social injustice? How can we promote prevention when we are not working in country, but through our local partners? And these questions need to be considered by your organization. There's no simple answer, but what you need to think about, and I would encourage you to have open discussions with diverse members, diverse staff members about how to address the root causes of sexual exploitation and abuse within your organizations. How can you address these root causes in field offices or partner organizations? And are there any best practices or lessons that you can share with others who are grappling with the same questions? In terms of response, when developing our policy, we really had to think carefully about the rights of both the complainant and the respondents in respect to PSEA. We have placed emphasis on a survivor-centered response, focusing on the needs and the rights of survivors, but our respondents also have a right to be notified that a report has been filed. They have a right to be informed of the process, have accompaniment, such as legal accompaniment, or a third party accompany them, as long as the third party does not intimidate the complainant or affect the process negatively. They also have a right to be treated fairly and have access to corrective support when appropriate and necessary. Now, our policy outlines step by step what needs to take place in terms of reporting. I'm not going to go into detail, but I would like to emphasize that there are informal resolution mechanisms, formal reporting mechanisms, external reporting mechanisms, and the decision to report internally does not prevent the complainant from reporting externally. And then there are also whistleblowing mechanisms in place which allow complainants to go directly to the executive director or board or even to an external authority. Regardless of the reporting route taken, it is important to note that we have emphasized over and over and again in our policy that if there is any violation of the criminal code, someone's life is at risk or a child is involved, a report will automatically be made to the authorities. Our policy also includes investigation and includes certain principles related to investigation, such as timeliness, being sensitive to the interests and rights of both parties, the complainant and the respondents, the importance of confidentiality agreements, relying on evidence and facts when conducting an investigation, making all efforts to prevent further trauma for the complainant, such as allowing the complainant to work from home or take leave, providing psychosocial support throughout the process of reporting an investigation, ongoing communication, bearing in mind confidentiality agreements, but also bearing in mind the rights to the complainant and the respondent to have access to information. Also certain principles around the withdrawal of consent. If a consent is withdrawn by the complainant, an investigation will be undertaken as to why it was withdrawn to see if this is a result of any forms of intimidation. We also have certain measures in place around data security and emphasis on not using non-disclosure agreements. So in terms of just in broad strokes, the process is as follows. If a report is made to a focal point, a response is expected within 24 hours. A meeting is held with the executive director within 48 hours, and both parties are informed of their rights in the process going forward. The respondent does have a right to respond in writing within 10 days. The executive director may consult with the board, convene an investigative panel or a third party to undertake the investigation. And this is quite important for small, medium-sized organizations where, like, if there are 6 members in the organization, it would be very difficult to undertake a confidential investigation internally. And then a final confidential report and recommendation needs to be given to the executive director within 10 days. When developing this process or when thinking through this process, you really need to think about the resources that you have in hand. You would also need to think about the principles. So for instance, confidentiality. How can you ensure that the process remains confidential, bearing in mind the nature and scope of your organization and the size of your organization? You also need to think about your capacity in relation to the focal point. In many of the organizations that we are working, and including our own, the focal point is also assumes other roles and responsibilities in all the organizations. So what is realistic, but also what is legally required in terms of the process. In terms of investigation outcomes, this is clearly outlined in our policy, but bearing in mind that any contravention of the criminal code will lead to immediate dismissal. We have also included certain corrective or reform programs, such as counseling, mentoring, workshops on gender sensitivity, intercultural communications, and healthy behaviors. But when thinking through the corrective and reform programs, it's important once again to reflect on intersectionality and power dynamics. So colonial attitudes, racial, discriminatory attitudes might be intersecting with gender and sex to enhance the risks faced by certain individuals and groups. So when thinking through corrective and reform programs, it is important to consider these type of courses or mentoring opportunities and counseling opportunities. And the same goes for considering and addressing the root causes within the organization. It's not simply about two individuals who might be affected, but this is likely to have been created in an organization that has got a poisoned work environment or an organization that's got power imbalances. So when thinking through the next steps, it is important to consider what needs to be done to address those root causes. Is it simply about a workshop? Or fundamentally, do we need to think about our policies in place, the norms and values guiding our organization, and some of the inherent and perhaps less explicit biases that we are all living with as a result of our colonial upbringings or as a result of our positioning in socioeconomic hierarchies. So this is very important when thinking through the next steps following an investigation. As I said earlier, in our policy, we've emphasized a very survivor-centered response. And in order to ensure this, it is important that when you develop the policy, you map the local service providers and you include it in a very accessible way in your policy documents, in the posters and guidelines that you've got available. It is also important to think through the referral protocol, bearing in mind the size, the structure of your organization, as well as the resources you have available for referrals and the type of support you'll be able to provide in the long term. It is also important to ensure that there is follow-up of the response and follow-up of the referrals made to ensure that the survivor does receive support and that this is documented and reported to the board and authorities. Okay. I have mentioned time and time again, survivor-centered. In other words, we are not focusing on those who are affected as victims, but we're trying to emphasize their agency, trying to emphasize their resilience, and try to empower them as survivors so as to support long-term integration and reintegration into the workplace and their communities and to build their psychosocial well-being. It's also important that there are other considerations in place in your policies. For instance, if the survivor is missing work as a result of this experience, or the survivor is not completing work tasks, these are seen as understandable reactions and there should be no penalties. There should also be efforts to protect the survivor from retaliation. And this needs to be carefully thought through in small organizations where confidentiality might be difficult to maintain. So it might involve giving survivors an opportunity to work from home or rethinking the spatial design of your workplace and the spaces, the safe spaces that are created in it. Survivor-centered responses also involve thinking about the spillover effects on the workplace. So there might be others in the workplace who have been indirectly affected by the incidents who may need some psychosocial support or other forms of support. And obviously, all of this response needs to be resourced. So when planning your policy and planning the type of response, you need to work up certain scenarios and think about how and where the resources will come from in order to ensure that the support is comprehensive, that it is timely, and that it does fulfill the needs and the rights of survivors. BCCIC works primarily with our members. We do, however, engage in community consultations, and we also work with youth in different contexts. Now, we have consulted with our members in developing a series of principles and requirements on how to work with communities in relation to PSEA. So fundamentally, all that we do needs to be value-centered. It needs to be based on mutual respect and non-discrimination, cooperation and understanding. And I'd like to emphasize here anti-racism and decolonization. These should form the basis of all your interactions with community members. Secondly, when thinking through prevention, you should design and implement your community-level programs and projects using PSEA risk assessment tools. But this should be done in consultation with local community members, because only local community members will be able to give you insights into the power dynamics that might create situations that place individuals and groups at risk. And as I've said earlier, when you consult with the local community members, you need to ensure that there are spaces for those who might be left behind or might be at risk of being left behind to have opportunities for their voices to be heard around potential power imbalances and root causes in their local communities. It's also important that any documents such as codes of conduct, reporting and referral protocols are co-created with members. Okay, and this needs to go beyond consultation, but should actually give members as well as local communities ownership over the materials, because this will enhance buy-in and uptake, and it will also lead to reflection on positive behaviors in local communities. And this dialogue is an important first step in not only sensitization around PSEA policies, but it's a first step in reflecting on power dynamics and reflecting on the vulnerability and the risks faced by certain individuals and groups, and then creating a safer, more socially inclusive and just community. When working with local communities, you also need to think about accessibility and language and the type of format you use. So for instance, having lengthy written policies in English might not be useful for communities that speak different languages. Having policies that are full of legal jargon or full of very legal or technical terms might not be accessible. We also need to think about those with diverse abilities or communities with low literacy levels, where having a written policy might not be as useful as having PSEA concepts and values expressed in different formats, such as artwork, poetry, storytelling, and so forth. In terms of reporting, you also need to think about how you would maintain an open door policy that creates a safe space for reporting. And also what type of feedback mechanisms you have in place to ensure that feedback is provided to communities, so that a report is not just made and then it disappears, but that you're able to engage with the community on how the case has been responded. So in terms of lessons around response, having clear roles and responsibilities in the organization is key. It's important not to rely exclusively on one individual, namely the PSEA focal point, but it's important to think about the roles and responsibilities of management, of employees and of staff and volunteers. It's also important to develop effective communication channels and institutional mechanisms when responding to PSEA. And this might require developing flowcharts for mapping the process, thinking about the resources at each step in those processes. Some organizations find checklists useful to ensure that protocols has been followed, but I hope that you would go beyond the checklists, which are more tokenistic, to ensure that there have been meaningful engagements with response. It's also important to ensure that, this is my daughter and she's going to be saying hi. Hi. Okay, Mummy's giving a presentation, so I have to be quiet, Charlotte. Shh. It's also important that you think about the implications for impartiality, confidentiality, and what partnerships are like in local communities and what this means for PSEA. There are several difficult questions that you need to answer as an organization. So what is meant by comprehensive, timely and quality survivor-centered support? How can SMOs ensure this when they're working with their local partners? And other questions around, for instance, the rights of respondents as well as complainants, if found guilty. Furthermore, it's important to build in monitoring and review when you develop your PSEA policies. So one of the things we've got in our PSEA policy is a reasonableness evaluation, asking questions around such as how effective were the policies and procedures? How timely was the response? How seriously was the complaint treated? What resources were made available? Was a healthy environment created for the complainant? And how well was the process and actions communicated to the complainant and the respondent? Who should undertake the reasonableness evaluation? In a small organization such as BCCIC, it is wise to contract a third party to undertake it. It is very difficult to think in a very comprehensive manner and think beyond personal relationships in small organizations to really understand whether a response was reasonable. It is also important to share the findings with the board and the donor, but this is only one of the layers of review that need to be put in place. So the reasonableness evaluation will take place after each response and after each report. But then there is also an annual review of operationalization and then a comprehensive review of the policy, in our case, every 4 years. We simply do not have the capacity to do a comprehensive review every year. However, that's not to say that the policy is fixed. We see policies at BCCIC as living documents. So if there are gaps or there are issues that are not being adequately addressed within the policies themselves, they will be updated on an ongoing basis. And these will then be sent to the board and in consultation with the board when reviewing and updating the policies. Now, working with our partners and members. So BCIC is unique in that we do work with organizational members, affiliate members, individual members, and we are in a similar situation as many of the other councils. So there are several things to consider when you are working with members such as BCCIC, or you're working with different partners. So I consulted with our members to understand what their needs were in relation to developing a PSEA policy, and in order to understand how useful our policy was and how useful some of the resources developed by Digna are for their own work. And this, I've identified 2 quotes in particular that provide some useful insight. First, the truth of the matter about our PSEA policy, we developed with a copy of BCCIC's from you. We found the shorter version more useful, and World Neighbours Canada. We also reviewed policies of other organizations such as CARE, Oxfam, etc. They are larger, so their well-defined policies did not reflect our reality as an SMO. We wanted a simple policy and not a complex policy. So here there are 3 points that can be raised from this particular quote. Firstly is accessibility. Policies that are longer are not as accessible as shorter versions. Okay? Secondly, policies that are complex are not as useful as simple policies for small and medium-sized organizations. It's also important to consider the reality of small, medium-sized organizations, and the policies that they developed need to reflect this reality. In other words, they need to be relevant and appropriate, not only to the legal policy context or even the socio-cultural context in which they work, but also the practical context in which they work, in relation to their resources, in relation to the number of staff they have in their organizations, in relation to principles such as confidentiality, in relation to other principles and values that might change the way that they seek to prevent or respond to PSEA. The second quote is also useful. The development of the policy has been pragmatic. We don't have any overseas staff, and we don't have an office where people work together. Also, we are spread around multiple locations, so the opportunities for sexual exploitation and abuse are more limited than they would be in a larger organization with a central office and overseas staff. So to develop our policy, we relied on samples of policies available through Digna and other sources, although we found that most of these policies were written for much larger organizations. So we had to modify the content greatly to fit our situation. So this is an important lesson, that the policies that are developed can be adapted from larger organizations. And in a sense, that certainly helps address some of the resource constraints and some of the barriers that small and medium-sized organizations face when conducting the analysis and the consultation and so forth required to develop a policy. However, any policy that is adapted needs to be really modified to fit the situation. And in this case, in this example, here a reference was made to the size of the organization, as well as the geographical scope of the organization. And then thirdly, in this particular case, the organization works in multiple locations. So the question is, how to develop a policy that can then be adapted by partners and staff in different locations? Is it a matter of creating a very simple, bare bones, easily adaptable policy? Or is it alternatively better to work to allow local staff members and local partners to develop their own policies that reflect the broader organizational values and principles, but are relevant and applicable in that local context? So these are some of the things that our members have had to work through and think about. So some of the lessons to consider are, what are the needs of the different organizations in terms of size, scope of work, resources, and partnerships? How can we ensure that the resources we develop, the policies and training materials we develop are accessible for different organizations? Also, how can we go beyond sensitization training and provide one-on-one support to members to accompany them through the process of developing as well as implementing and monitoring their own PSEA policies? I mean, at the moment, we've placed considerable emphasis on how to develop a PSEA policy, but we do need to think about the long term in terms of review, in terms of refresher, revision, and what this will entail. We also need to consider the context in which they work and the communities that they partner with. I mean, in those 2 quotes, you can already see that the context might be very different. And in some organizations, international organizations that are based in Canada, they not only work in certain provinces to which they need to be accountable from a legal and sociocultural perspective, they also work at perhaps at a federal level, but internationally, they might work in very, very diverse communities in the global south. And this needs to be considered when developing policies, training materials, and implementation strategies. Furthermore, from a policy perspective, you need to think about whether your members are bound by your policies. So I'm thinking specifically of like councils like BCCIC. So in their membership agreements, there are clauses around PSEA. And in these clauses clearly stipulate that when response is not adequate, partnership agreements can be terminated. But the question is, can we extend this to prevention? If they do not, for instance, adequately review power dynamics, if they do not adequately try and address some of the root causes of the power dynamics that might lead to abuse and exploitation, what does this mean for their partnership agreements in relation to BCCIC or other councils for that matter? Another important thing to consider is how do you go beyond simply having a policy or simply having a partner or a member sign on to your policy? And I think one important step is reaching consensus among diverse stakeholders and partners on what a collective statement would look like. And this needs to be done in a very nuanced, culturally sensitive way, bearing in mind some of the triggering reactions that could lead from such discussions and consensus building processes. And also it's important when you're thinking about reaching consensus around PSEA, we need to step back and also think about the root causes that create fertile ground for exploitation and abuse, such as colonial attitudes and norms and values, such as patriarchal norms, values and practices, racist norms, values and practices, ongoing indigenous oppression, because it is only by addressing these root causes can we truly prevent sexual exploitation and abuse from occurring. So in terms of resources, an important first step would be to consider some of the assessment and PSEA toolkits out there. So for instance, UNICEF had produced one in 2020 and 2020 that looks at certain organizational standards and what evidence you'd use around like developing an organizational policy, organizational management and HR systems, mandatory training, reporting, assistance, referrals, and investigation. But you really also need to think about what is relevant for your organization and what is realistic and doable considering your resource constraints. And as I said earlier, you need to be prepared to ask some of these uncomfortable questions. It's not just about ticking the box to say whether you've met the standards or not, but it is about thinking about some of those bigger issues. So I would like to encourage you to reach out to me if you've got questions related to the PSEA policy. My email address is zosa@bccic.ca. I'd also encourage you to take advantage of the resources offered by Cooperation Canada and Digna, as well as share knowledge and share lessons learned, as well as sharing some of the mistakes you've made along the way with other organizations grappling with this very difficult question, but this really fundamental issue. And as I said before, this should not be seen as just meeting a donor requirement, but it should be seen in line with the broader mission and values of your organizations. And it should be seen in line with strengthening, improving, decolonizing development practice more generally. On that note, I would like to say thank you for your time and thank you for your patience as I have explored these important steps and important principles and concepts in relation to PSEA. And I wish you the best of luck as you start working on your own PSEA policies or as you start to strengthen and think about how to meaningfully engage with PSEA in your implementation plans and your workplace strategies going forward.